Hi, my name is Dr. Katie Brown, and I am an OB-GYN at UCSF, and I've been a physician for 10 years. When I started on faculty as an attending OB-GYN, I had a couple of patients that I was supporting through their prenatal care and through their births that had SisterWeb doulas, and they were just so integral to the care that the patients were getting and to providing really just like empowered birth experiences for people who had had really traumatizing birth experiences before, even at the same hospital. And so I was just really blown away by the work that they do. And as a provider, I also felt really supported and caring for these patients who had a lot going on in their lives. And so I really wanted to get connected on more of like a regular level. And so I joined the Champion Dyad Initiative. I knew about SisterWeb and the work that they were doing, but then I became more involved when I became an attending, and I had like independent patients that I was seeing, caring for, and kind of guiding through the prenatal care experience, and trying to help make hospital births feel empowered and liberating instead of traumatizing. And then I also just wanted to learn from them. Like there's so many ways in which we learn medicine that really takes away the like natural process of birth, the like beauty of it, the autonomy and kind of power that can come with birth. And I feel like I've been really trying to undo that and undo the medicalization and stuff that I've learned. And I just feel like I learn from the CDI, the Champion Dyad Initiative, all the time. Yeah, so the Champion Dyad Initiative is like a initiative with SisterWeb and between UCSF. I know they have the CDI with all the hospitals that are based in San Francisco, which is great. But it's an opportunity for us to give bi-directional feedback on the experiences, both with providers and with doulas from SisterWeb. And so I feel like together we can work to support people and to improve the care that we provide in the hospital and break down racist and patriarchal experiences that people experience while giving birth in a hospital. And I remember when I first heard about it, I was like, this exists. Like it just felt like almost like a wave of like calm had come over me, because I was just like, this is amazing. Like this is what I've been looking for, to bring meaning to the work that I do and to just not feel so isolated, and be an opportunity to learn and reflect on myself and the way that I provide care and the way that I support people. So I was just really excited about it. The main outcome that I think of is people feeling like respected and like valued, that they had dignity, that they had space and power over their own bodies. When people are supported by SisterWeb doulas, I always feel like a sense of relief for the patient, because I know that they have this person who knows them and is making sure that who they are, what they value, and what they want for their experience is being centered and kept alive in the room, in a place where they're oftentimes like, it can be hard to do that. The rest of the providers, the rest of the team, they don't know the birthing person that well. So to have that and have seen so many people just feel so so much joy and power in their birth in such a really meaningful way. At a time where it's been really scary, I think, too scary to birth in a hospital. And I think scary, especially to birth right now as Black birthing people, when there's so much out in the media about like how it's not safe for us to birth. As an OB-GYN, I think it would be huge to have these collaborations so that people get a sense of understanding of like, what is the work that doulas really do, and how they're supporting people, because they're not just supporting people like at the bedside, they support them, you know, before, they support them afterwards. And the understanding that they have from the person and who they are as a person outside of that birthing room is so much deeper than what, you know, any provider in the hospital has. I think it would be critical to help break down some of the like contentiousness in the relationship, and I would hope also would allow OB-GYNs to kind of sometimes slow down themselves, to like take a deep breath, to understand this is a person who has these values and wants this. They deserve to have things explained to them. They don't want to be like have things done to them without their permission, and they shouldn't. Like, that's not something that anybody should do. So I think that those collaborations help hospitals become more safe and respectful places to birth. I think that doulas are integral to the healthcare team. I'd say probably for like everybody, but especially for my community of like Black and brown birthing people, who in healthcare spaces really have not been centered historically and today, have not been centered, have not been valued, have not had the space and rights to give autonomy, to give consent, and really the whole field of obstetrics and gynecology was built on coercively practicing on Black and brown bodies. So that is like so deep that that's the foundations of this field, and that legacy continues on in so many different ways. So I think that's why it's especially important for Black and brown birthing people, but it's important for everybody to have doula as a part of their healthcare team, because there's someone who knows the person, the birthing person, they understand their values, they give us a moment to, I think, a reminder to the healthcare team to pause, to explain, to ask for consent, to value the humanity in the birthing person, and that it is a birth and that they have like wants and desires for what that looks like. And I think just to be able to center that and to remind us from the healthcare team perspective is so critical for people to have first that they want, and even if not everything goes exactly as they want, but that they were empowered to make those decisions for themselves. Yeah, I think the work that community doulas do here in SF, like everything that they do is supporting Black maternal health rights in San Francisco. I think at the very foundation of at least what I as a provider see them do and support is to support like the autonomy of who they are, that they have choice in like how they birth, where they birth, who they birth with, and what that looks like. I think is one of the key rights that's not oftentimes honored in experiences of hospital birth today. There's so many different ways. I think one is funding for organizations like SisterWeb, so that they are sustainable and can grow, and the work that they do is supported to grow and to flourish, instead of having to really worry about where your funding is coming from and how to survive, because really the work that they do it's integral for birth specifically, that allows people to access the type of prenatal care that they want to, from the type of provider that they want to, access to home birth if that's something that they want to do, and access to birthing in a birth center or hospital birth that is that supports really what they want and who they are. Policies that support like housing and decent living wages, both here in the Bay Area and across the country, are also central to reproductive justice and rights. So when we think about maternal health care, it's like one small point, but the things that impact like the injustices that we see around reproductive rights and human rights, it's all connected. I think every patient should have access to doula care, and I think every provider should have the opportunity to really be enlightened by the type of support that doulas can provide, and to like push their own thinking as a provider to just maybe change and improve the way that you provide care.